Good evening, class. This is Medically Underserved in the United States by me. I'm Erica. What we'll be discussing today is working with the medically underserved, geographic access to care, shortages of providers, and socioeconomic status and race and ethnicity. What does it mean to be medically underserved? I have a quote here: millions of Americans are characterized as medically underserved, given that they live in a medically underserved with little or no health care, or that they are part of a medically underserved group or population known to experience economic, cultural, or linguistic barriers to health care. And my meaning of it is being in an area where you're uninsured, transportation is unavailable to get to health care. Some places like Steubenville is where we service clients who come from that area to come to Canton, where we are a more urban area that they can reach and get to have access to care. But they're underserved because it's not accessible to them. Culturally, sometimes they, in rural areas, it's only when something happens or there's a crisis that comes up that someone will access care or go into obtaining care. Culturally, sometimes in rural areas, they would prefer to take care of their own. If it's a broken limb or something else, they can fix it, they can wrap it up. In more urban areas, we have access to care, but it's whether or not we can afford the care that we are obtaining. Sometimes co-pays can be a little expensive. Emergency room visits can be very expensive. Also, urgent cares and stat cares can be expensive to those who we are working, but sometimes you just don't have the funds to actually pay. Some races, culturally, we don't seek out, with race and ethnicity, we don't seek out treatment, seek out medical care or health care, whether it be a primary care physician or not. We would rather wait until something happens. Socioeconomic status, having a low socioeconomic status sometimes will deter someone from obtaining care or having access to that care. They would rather no one judge them for how they are, what their status is in the community. And last but not least, preventative health, and that's supposed to say versus diagnostic care. Preventative health is eating healthy, something that many people cannot afford in rural or urban areas. They cannot afford to eat the brown rices, and white rice is cheaper a pound versus the brown rice, or vice versa. Diagnostic care is when you are up on your health, you get your wellness checks, you get your visits, and that way the doctor knows your history, he knows your health history, and he can treat whatever the issue is or whatever the problem is. A lot of people in rural and urban areas, more rural, lack the preventative care and the diagnostic care, where they just go right then and there and get their diagnosis and feel that they can get patched up or fixed up. The Health Resource Services Administration, it was established in 1982. This program was out of the Healthcare Administration, and they organized healthcare throughout the agencies and linking people and having a coordination of care, providing funding for clinics that came under them. They provided funding for those clinics It's over 3,000 sites in the United States of America that they serve the underserved community. It's people, they serve the underserved and the low income areas also. Places like your free clinics, your place where you have your minute clinics where you can go in and go out, not so much as the CVS type, but places where you can go and access just a doctor's appointment that day. If you have something going on that's been bothering you, sinusitis issues, they cover the umbrella of those agencies and can coordinate and refer you to other agencies. Problems that the medically underserved are facing. They cannot afford the medication. It's one thing to go to the doctor, but it's another when you cannot afford what they give you. If it's a pain med, I mean, and I remember one time going to the emergency room and a Motrin cost $20, and most people can't afford that, especially in these rural and urban areas where they have no insurance. They're uninsured, they have low income, and they would rather just know what's wrong and see if they can treat it with something over the counter or cheaper. Lack of transportation. I hear countless amounts of clients. That was one of their main issues of no-shows to appointments, is not being able to have transportation, because we have those clients in Minerva, in Alliance, and in other areas such as Steubenville, Barberton. We have these areas where they cannot make it, or they're carpooling to appointments. Limited hours of operation. We're open 8 to 5, Monday through Friday, I think with the exception of Monday and Wednesday, where we're open until 7, but that's not for counseling. So you miss that vital piece of counseling. Lack of childcare. We have so many clients who bring their kids to their appointments, and counselors either hold them, or doctors or psychiatrists, we try to do the best that we can to make them feel comfortable coming into our facility. Not practicing preventative care, that's one of the ones where they're coming to us in crisis mode. They're not seeking the counseling, but they don't have it in their areas. So that's one of the biggest problems. This here is a map of medically underserved numbers, and this was just in 2013. And from the lecture I read that these numbers have not changed since, and have since yet doubled the underserved communities. And we have mostly down in the southern areas where they lack a lot of dental care, a lot of primary care physicians, where in the urban areas we have it more accessible. We may not be able to afford it, but they can't even access the care to get to where we are. And this here is a graph of health professional shortages. Mainly physicians. 40% of primary care physicians across the United States are missing. It makes me think of a question of what are we doing as far as schools? What are incentives that we're offering to physicians, or encouraging our health professionals as far as when they're graduating to reach out into these underserved communities? We have 33% in the mental health and 27% in the dental, I believe. And we really don't have many physicians in those fields, MPs, and I got this information from a survey that they did amongst MPs, which is nurse practitioners, PAs, physician's assistants, and actual physicians. And basically, they cared so much because they felt like they were giving back to their community in ways of A, they grew up in these communities, B, they were a member of some type of group like Peace Corps or something where they did Doctors Without Borders. So they felt like the need to give back, or they had to. Current funding sources that we have now, Medicaid, Medicare, sliding fee scales, board funding. In certain counties, the board offers some type of stipend. I know here in Stark County we have our MAXIS funding from our Mental Health and Recovery Board, and they offer up to 60 days of covered service. We have free clinics, income-based programs. I know some stat cares, if you go in for a visit and if you do not have the income coming in, sometimes they will write that bill off. And these are my references. Medically underserved people, I was one of them. Most of them, we still have them today, and most of us are working class Americans, but we still lack the funding to take care of what we need to take care of in our community. Thank you.